just like to give you a brief history of what we call behavior change communication. We have the most evidence for behavior change from the health space. So this is where most of the theories come from. So you'll find that a lot of the behavioral scientists, a lot of the behavior change experts have worked in the health space or are currently working in the health space. So this gives us like a good understanding of how we got to where we are now. So back in the 60s, most of the comms was around fear messaging. So the idea was that if you scare people, they will change their behavior. So I'm sure you guys also still see like these graphics on cigarette packages and so on. But we know now very well that this does not really work. I mean, case in point, people still smoke. So what happens is that people just kind of go into denial mode. So, if you try to scare them into doing something, they're just not going to do it. So then we thought, okay, in the 70s, it became about, okay, let's try, more kind of cryptic communication and try like subliminal messaging and heavy use of posters, flyers, that sort of thing. So then, we came into the era of information, education, and communication, which is still used quite a lot, but is not very effective. Then we thought, okay, that's not working that well. So social marketing became a thing in the 1980s. So the idea then was, let's try to make behavior change exciting, and let's try to sell it the same way we would sell soap or a perfume or whatever. So social marketing is still big, and it's still, I think there's like an annual conference on social marketing. So it's still very relevant, and it has its place for sure, but it doesn't work for all types of barriers. And we can talk about that a little bit more. So then we understood that there's something more that we need to look at. So then we go into the 1990s, where behavior change communication becomes more prominent. So this poster, with the slogan, "Putting on a condom is just as simple as putting on your socks." So this is trying to target this idea that, putting on a condom is just so complicated and difficult and you never get it right. So kind of like touching on the self-efficacy angle. So still relying on the poster visual imaging aspects from information, education, and communication, but trying to be a little bit more targeted about what the barrier could be, right? So of course, that has morphed into different areas, especially in the condom use space. So, talking about reduced pleasure in condom use and so on. So you have like all sorts of barriers that are then targeted. And I would say like, especially for HIV, the HIV space, there's a lot of learning and there's also been a lot of success. Sorry, I'm still a little bit unwell. So, all right. So then into the 2000s, we then, start to embrace this idea that people don't live in a vacuum. So we'll talk a little bit more about that later. But, people are driven by what their family thinks of a behavior, what their community thinks, the policies that they live under, the societal structures. So we get more in the social impact space, we call this communication for development. But it's basically communication through community. So you're trying to, compel people to change their behavior by engaging various actors. So in the international development space, we talk a lot about community leaders, and those could also be religious leaders. And so you kind of engage them in the conversation to get people to change their behavior. Quite effective in various ways, which we can discuss later. What we do now is more what we would call behavioral design. So we are incorporating various elements from human-centered design, behavioral insights. So we're trying to address the behavior through a multifaceted approach. So in this example, in this poster, for example, this is a collaboration between two organizations, Girl Effect and Marie Stopes, who both work in the reproductive health space. But one organization delivers services. Marie Stopes, it's a clinical service provider. And Girl Effect does comms for young women. So then, Girl Effect is doing a lot of work around using drama, using social media to educate girls, mainly in the developing world, on sexual and reproductive health and rights. But then, they might learn all of this stuff, but where would they then go for services? So then, they try to address that gap by having this partnership with Marie Stopes. So then there's a space that they can go to actually access the services. So then we're looking at behavior change as a whole picture. So not just messaging. We need to help people move along the whole journey, from convincing them to doing something to actually helping them do the thing that we want them to do. Right. So as a definition, behavioral design, so it's an evidence-based, theory-driven process that identifies factors that influence people's behaviors and addresses these by using approaches that are most likely to produce positive changes in behavior. So I highlighted evidence-based and theory-driven. This is really, really important. So everything that we do in behavioral design when we're designing for change is that we have to do everything from a theory-driven and evidence-based approach, and we'll get into what that means. So behavioral design is multidisciplinary. Psychology is the central frame, let's say. So social psychology, especially, and behavioral economics. But we also, depending on the topic we're addressing, we also would tap into sociology, into comms, obviously, when we're designing campaigns and what have you, data science, anthropology, marketing. So whatever it is that we need to help us do our work well. But a behavioral designer, as such, would be trained in either behavioral economics, social psychology, cognitive psychology, something like that. So that should be like their strongest discipline, but obviously they need to work with people who have other skills to be able to design effective programs. And then of course you have subject matter expertise. So then you'd have to collaborate with people who might be experts in, let's say, change management or supply chains or whatever. So it's but still, we would want to borrow from multiple disciplines, but still keeping that psychology focus very strong. One model that I would like you to remember, if it's the one thing you take away from this, it's that behavior is socio-ecological. So I touched on this a little bit earlier. This is important because it also touches on this idea of systems thinking, right? So when we're talking about systems thinking, we're trying to understand what is the system around the behavior, or why is this thing happening. So I find that using a socio-ecological lens when trying to understand a behavior automatically gives you this systems thinking approach. So we always want to ask, why is the individual doing this thing? What is happening around them, in their family, in their community? What is the policy framework, and so on. You could also use this idea of socio-ecology in an organizational setting, right? So you can look at the organization as like the most outer level. So the policies within the organization could be seen as the most outer level. And then, the management could be the next layer, co-workers, and so on and so forth. But the point is to always try to understand the system around a person or behavior.